what's your thoughts on the balance of things like the benefits of skin to skin and bonding in contrast with things like the rooming in and baby friendly hospital initiative and having like mom being able to rest and everything like that. Obviously you see the picture I'm painting. I don't know quite what I'm asking, but where's the balance with that? And what are kind of your thoughts on that balance of the benefits of all of those things and also like the care that the parent who just gave birth needs and all of that? Because I remember with my first baby feeling in delivering in a baby friendly hospital and having she was actually down and they had a special care nursery and she was just down there for a few things. I had choreo, so she had antibiotics and was being monitored a little bit. Every chance they would put her right back in my room. And I just remember not sleeping and any of those things and actually just really wanting some time to just rest. And I wondered, but I see so often, especially on the natural birth community, like Facebook pages and things, like all of the, like you need the skin to skin, they need to be with you constantly, you need all this. And I just wondered if you could share kind of your perspective on the balance of that.
Sure. I think a lot of this also falls into the category of if a little is good, much more is much better. And I don't believe that, because knowing, first of all, the difference between first-time moms and experienced moms, there's a big difference there. And also traumatic births versus quote unquote normal births. So I feel like they don't individualize it enough to say who needs what. If you're in a baby-friendly hospital, everybody gets their baby 24 hours a day. And isn't that great that the baby can be with you all the time? I'm considered kind of like an anti, like they had us all have to take a course in how can we best make our hospital a baby-friendly hospital. And I was one that didn't really want to sign off on that, because I don't believe that you should not have a place that the baby can be taken, which is not like a shameful thing to the mom to take the baby away for a little while so the mom can rest. Because I think whatever delivery you have to have the opportunity to be able to say without judgment, yes, I think I would like to go take a shower now and someone else can watch the baby for 15 minutes while I take care of myself. I don't understand this thinking of once the baby's born, it's all about the baby and nothing about you. And I think that's what Baby Friendly Initiative has come to, that they just feel like it's great and it's better for both of you to have that baby with you 24 hours a day, even if it's not what you feel is better for you. So I don't like that whole thing. I like the idea of the opportunity to say, yes, I do need a little relief right now, as long as it's like, I never want to see my baby, because that's a red flag again for depression or anxiety or inability to cope. So I think it has to be really looked at on an individual basis. Like if you would like your baby in with you all the time, I think you can have that opportunity without feeling judged one way or the other. And if you feel like you need somebody to help you out and take the baby for a little while, I think that should be fine too. So I don't like the all or none thing. Skin to skin, I like moms to get that skin to skin immediately after the delivery if they want it. I mean, some people are like, ew, the baby's all messy, please don't put the baby on me. And I think that also should not be a judgment thing, because some people are less inclined to want a slimy, wet, bloody baby on their chest immediately. And I don't think it's fair for nurses to say, don't you want this? Everyone should want this. I think asking people what they will want beforehand is important, and going along with it. So I do like the idea if the patient wants the skin to skin as soon as I take the baby out, they want the baby right on them, great. There are no studies that say if you do that right away, you will have a better relationship with your baby or you will have better bonding. There are people who have had surrogates. There are people who have adopted babies. There are people who have, had whatever kind of early bonding experience with their baby that really, I can't say it has no effect, but it doesn't have an effect enough to feel like you better do that stuff or else you're doomed to not bond with your baby. That's so false. And that narrative from the natural birth community of what you must do to have a better relationship with your baby down the road, I wish they would shut up, because it's not true. And it's so easy to make moms feel so judged for not doing those things if in the moment or in the first few days they're not into that or that's not their choice. So I like the idea of giving the mom the choice of what they would like to do. If they want the skin to skin, most moms actually do want it, and right away if possible, and we give them that opportunity. But if they don't want it, I think they should have that opportunity to say that's not on their agenda, and instead, I'd like to do this, or I'd like you to wrap the baby up for me first before I hold the baby, or something like that, and that's fine. And then postpartum, I think we put a little bit too much pressure on the moms to have the baby with them all the time and to nurse exclusively if that wasn't what they exactly wanted. And so I encourage my patients during, let's say they're mostly in their third trimester, to tell me what it would be important for me to put on their chart for the postpartum nurses and the nurses that are at their delivery to know, because I don't think that's the time to be asking the mom, were you planning to breastfeed, or don't you want to breastfeed exclusively? I think that should be part of the plan, and people should share that. And they should already know, with a little conversation as to maybe things might change. You might have wanted this, but now you want this. I don't think any of it should be assumed. I don't think any of it should be, well, all new moms should want this. No, it's very individual. And I think they should make allowances for that individuality, that when people deliver, or what their plan is for postpartum, or people who don't want to nurse at all, they should be able to say that without the judgment and be able to just get the bottles when they need them. So that's my take on it. I'm not very popular in my hospital.